If we can get a teen in our door and we can understand that as clinicians and come from that lens and be compassionate and just focus on that initial connection with our teens, most times the willingness, the cooperation, and the trust that we're able to build, even in that 30-minute to an hour assessment, however long it takes, makes a huge difference.
Hi, my name is Kent Toussaint. I'm a licensed marriage and family therapist, and I specialize in helping kids, teens, and families to live happier lives. I lead 2 organizations, Teen Therapy Center, which is a group private practice in Woodland Hills, along with a nonprofit organization called Child and Teen Counseling, both in the same office. I've been in the industry for 20 years, been a long time.
Yeah. My name is Selena Serna. I am the program director here at Clear Behavioral Health, licensed clinical social worker. I too work with teens and families, and I have been doing this for altogether about 8 years as a clinician, going on 5 very soon.
The expectations, the perceived expectations, sometimes the parents' expectations are not matching what the kids' expectations, what the kids think their expectations are.
Yeah.
Is that, I don't know if that's where you're going.
Yeah, I mean, yes, and the values that are placed on our teens from the parents, right? I mean, there's so much I can talk about with that, but to your point, so like, having to get all A's, having to get a certain GPA to get into college, it's so competitive now. So many teens that I've worked with have that pressure from their parents, from teachers, and to your point, the cognitive distortions that come with that, again, these negative core beliefs that are developed do stick with our teens, and is super important to talk about and to bring awareness to in our work.
Absolutely. Piggybacking what you're saying, all that pressure gets magnified by social media.
Yeah.
And the social media pressures of the comparisons of, well, she's going to this college or she's doing this, and it looks like she has this perfect life on social media, which of course she doesn't.
Right.
But that's the impression the child has. And then the parents, they fall into the same trap because they're comparing their parenting skills to what parents are projecting on social media, which may not be an actual representation
Right.
of what those parents are going through.
Right.
And so it's always this, I'm trying to keep up with the Joneses. And it's tough because the social media pressures that are put on teens and parents in this vacuum of no one's talking about it, and it just makes the anxiety grow and grow for everyone.
Right. And this goes beyond academic pressure.
Yeah.
This goes with having a certain body image,
Yeah.
right? Having to present a certain way, which goes hand in hand with body image, seeking validation from peers online. And, there's something to be said about social media and even this addictive piece that our teens are experiencing, right? Having to get that dopamine and that reward from social media, from the likes, from the validation, has really done something to our teens. And I don't know, and if your experience, Ken, if you're seeing that, but we're seeing that more and more here. And there's not enough, I think, education from adults, from parents, from other family members, teachers, mentors, whatever that may be, on limits with social media, having to swift out what's reality and what is not, and how does that differ from my life, and these comparisons that we're talking about right now, helping our teens being able to recognize when that is happening and how, again, to swift out the reality versus what is being shown, because most times it's just the positive things, it's just the glamorous parts of people's lives, right? It doesn't really show the day-to-day and the ins and outs of things. So it's really important to have that education and to be able to teach our teens that as well.
How do we help these teens who are struggling with anxiety or panic attacks?
Yeah.
Usually it's not like in the moment, it's just trying to like triage, but it's really in between. It's like the self-care. It's like you don't just take care of your teeth when you go to the dentist. It's the brushing your teeth every day. It's boring, it's tedious.
Yeah.
But if you brush your teeth every day, you're likely to avoid cavities. Ballpark, right?
Right.
So how do we help our teens find that resiliency. And I usually see it as 4 basic categories we want to help our kids. And some kids will be higher in some categories than the other, but it's healthy physical stimulation, healthy creative stimulation, healthy social stimulation, healthy spiritual stimulation. Again, some kids or some people will have more in one category than the other. You're not going to have all 4 most likely.
Right.
But if you have 1 or 2, like if you can get your kid really into piano, and they really love piano, in one of those categories, physical stimulation, social, creative, or spiritual, they really find a joy in that. I think that's going to help because that builds that self-esteem.
Yep.
That builds that self-worth. Like this is something that I can do. And again, we're not going to take anxiety away, but it helps mute it a little bit. The frequency, the intensity come down. And I think that also helps that resiliency in knowing, okay, yeah, this is a horrible day, but I've got this one thing.
Right.
Is that what you see too?
All the time. And, I'm like nodding my head as you speak, because one of the things that our clients say and our parents say is like, help me fix my kid. And what does that mean? Right? Because these are lifetime experiences, right? It's how do I help you, again, bring the awareness, do something different about it, but also accept the piece that this is going to happen, but hopefully through this work and through the maintenance of what you're speaking to, it's less intense, it happens less frequent, and when it does come up, and now I know what to do.
How we deal with a resistant teen at Teen Therapy Center, which is all the time, that's Tuesday. I always tell the parents, if they can get the kid into our office, we can take care of the rest. Because oftentimes kids do want to talk. They're just terrified, or they don't want their parents to know. Like, we'll do the intake session, the mom and dad will come in, the kid will be there, and the kid's sitting there like, I'm not gonna talk, dude, I'm not gonna talk. And as soon as the parents leave, they start talking. And it's enjoyable, it's an engaging conversation. Bring the parents back in at the end of the session. This was stupid. And because there's this conflict between parent and child. It's not every time. There are times when it takes a while to break through that resistance. But if they're actually willing to come here, that's half the battle. And over time, they recognize that we're on their team, we're not a vice principal.
Yeah.
And it's like if it's in a group situation, they start recognizing all these other kids like being here. Maybe this is something cool to do. We prefer doing therapy in person when possible. We think it's much more effective than online. We do have some online clients. If the kid is open to being online, we'll do that. But if they're resistant, it's going to be even harder. But if they can't, they just refuse to come in and they're refusing treatment, and then there's a real crisis going on, it may mean that they need a high level of care, maybe like a residential setting. Obviously, I'm painting with a broad brush. It all depends on the client.
I agree with you. Also, there's something to be said about a resistant teen. We talked about powerlessness and feeling helpless as a parent, right? What about our teens? Teens who don't understand what they're experiencing and the amount of helplessness that they feel, and me being forced to go into an intensive outpatient program like ours, or even outpatient therapy. I'm giving up that control, right? To Kent's point, if we can get a teen in our door and we can understand that as clinicians and come from that lens and be compassionate and just focus on that initial connection with our teens, most times the willingness, the cooperation, and the trust that we're able to build, even in that 30-minute to an hour assessment, however long it takes, makes a huge difference. And one of the things that I tell parents all the time, just come tour. There's no commitments. You don't have to commit to being here. Bring your teen in, let them see the environment. It's pretty cool if you ask me. I like this place. Come look at the environment and you'll see it's not a hospital setting. Most teens think intensive outpatient program hospital, and it's not that. So always trying to get the teen just to come check it out, meet the staff without any commitments, and sometimes that's helpful.
Mm-hmm.